Hello everyone. So now we are going to talk about dental plaque. Okay. So this is going to be a very important and a very interesting chapter. Okay. Okay. Before moving or before discussing about what is a dental plaque, you should first understand that plaque is nothing but bacteria. Okay. Plaque is nothing but bacteria, and when a diverse community of microorganisms join together, I'm going to call that as biofilm. Okay, when a diverse community of microorganisms join together, I'm going to call the term as biofilm. Okay, so any form any form of plaque, be it supragingival or subgingival, it will have bacteria invariably, and when this plaque matures, it becomes calculus, which will be discussed in a further topics. Okay, fine. Now, so dental plaque can be of two types. Okay, it can be supragingival or subgingival. Okay, it can be supragingival or subgingival. Now supragingival can be tooth associated and outside, whereas subgingival is tooth associated and tissue associated. Okay, so basically, if a supragingival calculus tooth associated, it will predominantly have gram positive cocci, which are nothing but streptococcus sanguis. Okay, streptococcus sanguis, actinomyces viscosus, actinomyces nelundi. Okay, and the supragingival block outside will have gram negative, especially filaments. Okay, gram negative filaments. And subgingival plaque tooth associated will have, it will be of three parts. First one is the coronal, mid, apical. Coronal will have gram negative filaments, mid portion will have gram positive rods, and apical portion will have gram negative rods. Okay, so the coronal portion is going to have gram negative filaments, the mid portion is going to have gram positive rods, and the apical portion is going to have gram negative rods. Okay, so the tissue associated will have gram negative rods. Okay, so this will be the overall view of a supragingival and a subgingival plaque. So plaque as supra tooth associated outside, tooth associated predominantly will have gram positive cocci, streptococcus sanguis, actinomyces viscosus, actinomyces neelundi, and outside you see predominantly gram negative filaments. And subgingival, you see tooth associated, coronal, mid, and apical. So coronal, if you see, it is gram negative filaments, mid we see it's gram positive rods, and apically you see it's gram negative rods. And tissue associated, you can see that there will be predominantly gram negative rods. Okay, so now moving on to the formation of a dental plaque. That is very important aspect, formation of dental plaque. So the first foremost step in the formation of dental plaque is pellicle formation. What do you mean by pellicle formation, sir? Very simple. Pellicle formation means certain proteins, salivary glycoproteins, which is present in your saliva, they form a glue-like substance, a glue-like material. Okay, so once they adhere to the tooth, they will frame a base work for the other bacteria to sit over it. Basically, it's like a glue. Whatever you place in the glue, it is going to stick there, right? So pellicle formation is by the salivary glycoproteins like proline rich proteins, statins, glycoproteins. Okay, so all these, what happened over a period of time after we eat, there is going to be deposition of these salivary glycoproteins to the tooth surfaces. Okay, the second step in the formation of the dental plaque will be initial adhesion. Okay, the second step will be the formation of initial adhesion. So any bacteria which is present in the oral cavity is brought to the site, or it moves in the liquid, right? So that is called as Brownian movement. That is called as Brownian movement. So the bacteria which is present in your saliva or in your oral cavity is moved to the site of pellicle, because it can easily stick to the pellicle, right? Because pellicle is like a glue. So the bacteria which is present in your oral cavity, they move with the help of Brownian movement. That is a movement of the bacteria or movement of any substance in the fluid is Brownian movement. So with the help of a Brownian movement, especially 40 micrometers per hour. Okay, so with the help of this, it moves towards and attaches to the pellicle. Okay, so the bacteria, it attaches to the pellicle with the help of the Brownian movement. So the initial adhesion, if you see, it can be of two ways. Either it can be a reversible type of attachment, or irreversible type of attachment. Okay, so it can be a reversible type of attachment or irreversible type of attachment. So what do you mean by reversible and irreversible, sir? Very simple. See, if the bacteria is attached to the pellicle and it is at a distance of around 5 to 20 nanometer, then that is reversible, which means you can disrupt the plaque. Okay, when the bacteria comes very close to the tooth, say for example less than 2 nanometer, it becomes irreversible. Okay, so when a bacteria is around 5 to 20 nanometers from the tooth surface, it becomes reversible. When the bacteria is extremely close to the tooth surface, that is less than 2 nanometers, it becomes irreversible type of attachment. Okay, so the reversible attachment is by the weak van der Waals forces. Okay, weak van der Waals forces, whereas irreversible attachment will be by covalent or ionic bond. Will be by the covalent or ionic bond, right? So as I told you that the irreversible and the reversible. So irreversible, it is by the, if the bacteria, if that attaches to the tooth less than 2 nanometers, and it is by covalent or ionic bond. If it is 5 to 20 nanometers, reversible, weak van der Waals forces. So the second step will be initial adhesion. The third step will be colonization, right? So see, basically some bacteria will attach to pellicle, isn't it? So that if the bacteria attaches to the pellicle, it has to have some nutrients in the pellicle so that the bacteria survive. Okay, the nature of the pellicle is like a glue, so that it allows the bacteria to stick onto it. Similarly, the bacteria, once it sticks, it also have nutrients, right? Similarly, certain bacteria, say for example Streptococcus sanguis, will attach to proline rich proteins, which is nothing but a pellicle which supplies the nutrients to the Streptococcus sanguis. Actinomyces viscosus will attach to proline rich proteins that supplies nutrients to both these. Okay, the third one will be colonization. Okay, the third one will be colonization. So what do you mean by colonization is, it's very interesting aspect. Okay, some bacteria will help the growth of other bacteria. Say for example, when I see one of my friends struggling, if I am in a good position, I'll try to give him financial support, or I will offer him some job. I'll try to help him in one or the other way. Similarly, there are a few bacteria which will help the growth of other bacteria. Okay, that is what is called as metabolic mutualism. Metabolic mutualism. Okay, so metabolic mutualism is done by several bacteria. I'll tell you a few bacteria. Okay, Fusobacterium nucleatum. Okay, Fusobacterium nucleatum produces fatty acids, okay, which is very helpful for the growth of Treponema species. Fusobacterium nucleatum, okay, Fusobacterium nucleatum produces what is called as the cut. Fusobacterium nucleatum produces ammonia, okay, which increases the pH, and it favors the growth of Porphyromonas gingivalis. Okay, and another species, say for example Streptococcus sanguis and Actinomyces viscosus, they produce lactic acid, which helps Veonella species to grow, and these Veonella species in turn help the growth of P. gingivalis. Okay, and also the most virulent bacteria that causes periodontitis is Porphyromonas gingivalis and Aggregatibacter actinomycetum competens. So anything which favors the growth of these two is considered as periopathogenic bacteria, and so it favors the environment to be more detrimental and causes more destruction. Okay, excellent. Now, Campylobacter rectus produces protoeme, which help the growth of P. gingivalis. Okay, so these are all the few bacteria which takes place a very important role in metabolic mutualism. Fusobacterium nucleatum produces fatty acids, Treponema species. Fusobacterium nucleatum produces ammonia, which increases the pH, growth of P. gingivalis. Streptococcus sanguis actinomyces viscosus produces lactic acid that helps in the production of Veonella, which in turn helps the production of P. gingivalis. And Campylobacter rectus it introduces the production of protoeme, which increases the production of P. gingivalis. Fine. So now, by this, the bacteria grows and it communicates with each other. It forms a diverse biofilm, indestructible, or you cannot destroy it. It forms a strong bond between each other, right? And meanwhile, they also do what is called as quorum sensing. Okay, so quorum sensing is nothing but the bacteria, they communicate with each other and they adapt themselves to the external environment. How? Very simple. Say for example, I'm having more amount of P. gingivalis. Okay, What this speech gingival will do is it will release some chemicals into the environment, into the oral environment, that is called as auto induces. Okay, auto induces. So these auto induces are nothing but these are chemical agents. It will sense any changes in the environment. It will sense any changes in the environment. Okay, if there is an increased bacterial density, volume, growth, these auto-inducers will send signals to that bacteria, and that bacteria will recognize these signals, so they will adapt themselves to the external environment. So by this, the bacteria express their virulence, or whatever it may be. Okay, it expresses the virulence, the density, it adapts themselves to the external environment. Bacteria adapts itself to external environment. So in this way, quorum sensing helps bacteria to communicate with each other, to communicate to the environment through some chemical mediators, that is auto induces, and it in turn receives signals from the auto induces saying that okay, everything is big, you must also grow. So it changes the shape, virulence factors, conjugation, everything, so the bacteria grows. Okay, so this is called as quorum sensing, and the exact opposite to quorum sensing is quorum quenching. Okay, so the destruction or the stoppage of the quorum sensing process is quorum quenching. Okay, so I hope you understand till now. So we have discussed about plaque, what is the classification of plaque, and how the formation of dental plaque takes place, and also we have discussed about quorum sensing. Now coming to the composition of a dental plaque. Dental plaque will have organic and inorganic. So the inorganic will obviously be calcium phosphate. The organic content will be glycoproteins, lipids, and certain ground substances. Okay, so these are all the composition of a dental plaque. So we will be further discussing about what are all the plaque hypotheses, and also I'll be discussing about how to inhibit, or how the biofilm inhibits the antibodies, how the biofilm inhibits the antibody production, how it becomes resistant to antibiotics. Okay, so and any microorganism, okay, it will be either sacrolytic or asacrolytic. Sacrolytic means it uses carbohydrates. Okay, it uses carbohydrates to produce lactic acids, and that help in the growth of bacteria. That helps in the growth of bacteria, especially gram positive bacteria. Okay, so saccharolytic organisms utilizes carbohydrates to produce lactic acid, which in turn helps the growth of bacteria, especially gram positive bacteria. In case of asaccharolytic, it uses certain nitrogenous compounds from the GCF. Okay, certain nitrogenous compounds from GCF. What happens? They utilize ammonia, that becomes alkaline, pH becomes alkaline, so that favors anaerobic environment, and increased production of P. gingivalis. Increased production of P. gingivalis. Fusobacterium nucleatum, Provitella intermedia, Thanarella forsythia. Okay, it induces the production of all these organisms. So any organism either utilizes carbohydrates or some nitrogenous compounds from the GCF, and that results in the growth of the bacteria. Okay, so in the upcoming parts we will see about the various block hypothesis and the antibiotic resistance of the biofilm. Thank you.